Welcome to muscle unit video number 4. This is our second lecture. I've taken the human body and I've divided it up into sections. And the reason I've done that is to make it much easier to study and much easier to lecture on. There are so many muscles in the human body. There are lots of ways to divide up the human body. And this is the one I like the best. This is not an established muscle group. What makes a muscle group is an actual defined term in human anatomy. And I'll be talking a little bit more about that in just a few minutes. But let's go ahead and get started. We'll be talking about the deltoid first. This is the muscle on the shoulder that everybody thinks of as your shoulder. This is what makes your shoulder, really. The origin is on the clavicle, which is what you're seeing right here. This is a front side picture of the body. And the origin, in fact, kind of wraps around the shoulder area, and it also has an origin point on the scapula, which is the shoulder blade. Its insertion point is here on the humerus, and its job or its action is to adduct the arm. And abduction of the arm, if you'll remember from our joint movement section, is lifting the arm away from the midline. So bringing that arm up, that's the deltoid's job. And the deltoid gets its name from its shape. You can see here that it's triangular shaped, and that's where deltoid gets its name, for delta. Next, let's talk about trapezius. This picture actually shows two trapezius muscles. You have two of them, one on each side of the body. The origin is along the vertebral column from about C7 to C12 or T12. And there's also an origin point here on the skull, right at the occipital bone. Its insertion point is here on the scapula. And its action is to retract the scapula. So if you pull your shoulder blades back, you're arching your shoulders, that's what the trapezius is doing. That's its job, is to pull those scapula back towards the spine. Now, this is our first established muscle group. And like I said before, my lectures are not really built around muscle groups because muscle groups is an actual defined term in anatomy. A muscle group is a group of muscles that all have the same action. That's what a muscle group is. This is our first actual muscle group, the rotator cuff muscles. So all of the muscles in this group are going to have the same action. And there are several other muscle groups throughout this unit that we will be talking about. But please know that these are established muscle groups and that they have an actual meaning in anatomy. So the first muscle we'll be talking about in the rotator cuff muscle group is supraspinatus. The origin of supraspinatus is in the supraspinous fossa, which, if you remember, is a depression on the scapula right here. This is the scapula. And supraspinous fossa is right here underneath this muscle. The insertion point is here on the humerus, and its action is to rotate the arm. That's why the rotator cuff muscles are called rotator, because they rotate the arm. So all of the actions for these rotator cuff muscles are going to be to rotate the arm. Infraspinatus, it has its origin point in the infraspinous fossa, and its insertion point is here on the humerus. And again, its action is to rotate the humerus or rotate the arm. These are the things that allow you to spin your arm in a circle or circumduct your arm. Then we have subscapularis. And I want to draw your attention to this picture because, as you can see here, here's the sternum, here's the clavicle. So we know we're looking at this from the front of the body. And you can see they've cut away the rib cage so you can see this muscle. This muscle is underneath the scapula. It's in the subscapular fossa, so it has a little shallow depression on the scapula where it actually originates. And then that muscle comes from underneath the scapula and inserts on the humerus. And again, the subscapularis's job is to rotate the arm or rotate the humerus. That is its function. This is our last rotator cuff muscle. So there have been 4: supraspinatus, infraspinatus, and subscapularis, and now teres minor. Teres minor has its origin on the lateral border of the scapula, which you can see right here, and it inserts on the humerus. And again, its action is to rotate the arm, just like all of the other rotator cuff muscles. It's really important that you remember teres minor. The other 3 are really kind of easy to remember. The most difficult one is teres minor. And the reason for that is because it has a big brother called teres major, who is not a rotator cuff muscle. Teres major is not a rotator cuff. Teres minor is, teres major is not. Teres major has a very similar origin. It's here on the lateral border of the scapula. But if you look at its insertion point, it's farther down on the humerus. It's really what makes the backside of your armpit. Because if you look at all of these other ones, they're all really up close to the head of the humerus. That's where they all insert. Whereas teres major is down on the shaft of the humerus, and that's its insertion point. So it's not a rotator cuff. Its action is actually to adduct the arm. So we talked about abduction with the deltoid. Now we're talking about adduction of the arm with teres major. Our next muscle is latissimus dorsi. This is a huge sheet of muscle that extends from your spine. It even has origin points here on the iliac crest. And then it inserts all the way up here with your humerus. And its job is to adduct and pull the arm back. This is what swimmers use when they make their downstroke with their arm as they're going through the water. They're using their latissimus dorsi to pull that back. This is why they have really great definition here on their back. So, origin along the spine and the iliac crest, insertion here on the humerus, and of course the action is to adduct and pull back the arm. Now we have rhomboideus major, and this is the last one we will cover with back and shoulder muscles. There's a rhomboideus minor, which is this small one right here. I'm not going to ask you to know that. I want you to know rhomboideus major. The origin is here on the vertebrae. Its insertion point is here on the medial border of the scapula. You can just put scapula. And its action is to retract the scapula. Very similar to the trapezius, pulling that scapula back towards the vertebrae. So that is our first section of muscles. We covered back and shoulder, and we talked a lot about the rotator cuff and what it means for a muscle to be part of a muscle group. So make sure you have filled out all the questions on your note sheet and that everything is ready to go, and move on to the next one.